Welcome, nursing students. I'm Professor Rivera-Mitu, and today I'll be sharing high-yield, clinically relevant test-taking strategies designed to help you succeed on NCLEX and classroom exams. These techniques are especially useful when tackling Next Gen NCLEX style questions. We'll go through prioritization, pathophysiology cues, drug mechanisms, and core frameworks like ABCs and Maslow. Plus, I'll include sample questions after each tip to help you apply what you've learned. Let's go to the tip for today is Maslow's hierarchy. So the Maslow's hierarchy of needs is a useful framework for prioritizing patient problems. We start with the most basic physiological needs like breathing and circulation before addressing safety, social, esteem, and self-actualization needs. This bottom-up approach ensures that life-sustaining issues are managed first, which is critical both in exams and clinical decision-making. Keep this hierarchy in mind when faced with multiple patient problems. In this revised Maslow's hierarchy of needs, I've added some test keywords that may be helpful in identifying whether something belongs under the physiological, safety and security, love and belonging, or esteem needs. So, beginning from the bottom and physiological needs, some keywords that are related to survival would be important, such as oxygenation, nutrition, hydration, elimination, sleep, or homeostasis. Some test keywords that you could look for are airway obstruction, stridor, hypoxia, oxygen saturation, chest pain, SC elevation, dehydration, hypotension, hypoglycemia, tube feeding, NPO status, urinary retention, pain requiring opioids, electrolyte imbalance, seizures, and LOC changes. So anything that affects ABCs, vital signs, or life-sustaining processes will fall here. In the safety and security needs, we focus on physical and psychological safety, protection, order, security, freedom from fear. Some test keywords to look out for might be fall risk, bed alarm, suicide precautions, seizure precautions, isolation protocols such as neutropenic precaution, restraint use, safety devices, abuse, including child, elder, or domestic violence abuse, medication error, prevention, IV site infection, and staff to patient ratio issues and confused patient or wandering. So the tip here is these come right after physical survival and include safety measures or risk prevention. In the third one, love and belonging needs, we focus on emotional support, relationship, communication, and social interactions. Some task keywords to look out for are social isolation, ineffective family coping, interrupted family processes, lack of support system, grieving or loss, therapeutic communication, the patient feeling abandoned, reuniting family at bedside, counseling for adjustment, or peer support groups. These are important but not urgent unless connected to safety or physiologic compromise. In the esteem needs, we focus on confidence, recognition, achievement, respect for others. So test keywords here are body image disturbance, low self-esteem, loss of independence, impaired role performance, self-care deficit, feeling like a burden, non-compliance due to shame, anxiety about physical limitations, cosmetic disfigurement, concerns, and return to work fears. So the tip here is that these all relate to the patient's sense of dignity and often show up in chronic illness or rehab. And finally, I know the pyramid doesn't show this, but at the very top is self-actualization. And so here we're looking at personal growth, self-fulfillment, and realizing one's potential. Some test keywords to look out for are spiritual distress, desire to contribute or volunteer, creative expression, such as in art or music therapy, career goal discussions, life purpose or legacy concerns, coping with terminal illness gracefully, reflecting on life accomplishments, advanced directive planning, and end of life fulfillment or bucket list requests. Let's put Maslow's into practice in this next gen bowtie NCLEX question. So under the STEM, it says that we're going to read the nurse's notes below. And the scenario is that Mrs. Joe, a 78-year-old female patient, is admitted to the medical surgical unit after suffering a left-sided ischemic stroke 3 hours ago. She is lethargic but arousable, confused, pulling at her IV lines, and has difficulty forming words. She has a facial droop and slurred speech. Family attempted to give her ice chips, but she coughed immediately and seems unable to manage her secretions. And it's asking us, based on the clinical scenario, identify the priority clinical condition, the most appropriate assessment, and the most critical nursing actions to address the patient's needs. So some important keywords here are the words priority, clinical condition, and the most appropriate and most critical. So even though some of the options here may be correct, we are looking for the ones that are the most appropriate and most critical. And based on this bow tie, we can see that we need to come up with the condition in the middle. And from that condition, we're going to look for two related assessments and two related actions. Our options for the conditions are fall risk, aspiration risk, risk for infection, and risk for impaired verbal communication. Under assessment, we are going to either evaluate swallowing, check blood glucose, assess for unilateral weakness, assess for bowel sounds, or perform a focused neurological exam. Under action, we are either going to initiate thickened liquid diet, elevate head of bed to 90 degrees, apply soft wrist restraints, administer PRN sedative, or keep the patient NPO. Pause here as you think about what the responses would be, again, utilizing the Maslow's hierarchy of needs. And the correct answers are for the condition, it's aspiration risk. This is the highest priority per ABCs and the Maslow due to signs of dysphagia post-stroke. The assessments that are related to this would be evaluate swallowing. This is essential to determine if the patient can safely tolerate oral intake. And also we need to perform focused neurological assessment. This helps assess level of consciousness, cranial nerve deficits, and stroke severity. The actions that are related, we want to keep the patient NPO, as this prevents aspiration while swallow reflex is unconfirmed. And we want to elevate the head of the bed to 90 degrees to support the airway and reduce aspiration risk. So why are the other options incorrect? First, let's look at our soft restraints. So this may be considered, but only after safety assessments and physician orders. They are not first line. Also, thickened liquids are unsafe without a confirmed swallow screen. The PRN sedative worsens the level of consciousness and increases aspiration risk, so we don't want to do that either. With regard to the assessments, checking blood glucose and assessing bowel sounds may be important part of the admission or your physical assessment, but they're not directly related to any aspiration risk. And they're also not mentioned in the scenario. We can assess for unilateral weakness, but that's also part of your focused neurological exam. Thank you for watching. If you found this video helpful, please give it a thumbs up, subscribe to my channel, and share it with your fellow nursing students. Your support helps me reach more students and provide valuable content. Remember to subscribe to my channel to be the first to know about more test-taking strategies and concept map videos for different diseases. Remember, together we can make a difference in our nursing journey. Until next time, this is Professor Rivera-Mitu. Stay curious, stay compassionate, and keep learning. See you next time.